All right. So that was a really great presentation. I don't know if I can measure up to that, but I'll try. Good morning, everyone. Thank you for attending this. Can you hear me? Yeah. All right. Thank you for attending this. This is somewhat different. We switch gears into talking about more geospatial data. So in this presentation, I'm not only going to be talking about geospatial data, but providing some of the tips and pointers that you might be able to use how to incorporate geospatial data into your everyday practice. So that's kind of the idea. So let me go ahead, and this was a kind of a collaborative effort between students, faculty, alumni. So what is the background? And I know this is a busy slide. So if we're thinking about social determinants of health, that's something that we use frequently in public health. And obviously, all of you probably have had lectures in the previous couple days that goes into the social determinants of health. But what is important, what I'm going to be going over today, is looking at how social determinants of health are related to geospatial considerations. How many of you have used geospatial analysis over here? All right. So a handful of you. I'm hoping you could kind of incorporate this into your repertoire of geospatial analysis. So, of course, as you all know, SDoH disproportionately impacts lower income and other vulnerable demographics and could impose a disease poverty conundrum through generation. So using social determinants of health and allowing that to kind of guide your research and understand how these relate to each other. And obviously, multidimensional genesis. So if you think about poverty, I mean, poverty, are you poor or not? What's your income? You can just kind of ask that, and that's it. But poverty has multiple dimensions. There's multiple factors that are incorporated into poverty: low education, in terms of unemployment. So there's multiple facets, and so multicollinearity, of course, is a concern. But when we're thinking about social determinants of health and some of those independent variables, you kind of have to not necessarily ignore, but assume that you're going to have multicollinearity between the variables because they're related. So the impact of upstream SDoH variables, so things that kind of can be controlled. So like ACEs, right? Adverse childhood conditions. Those are actually upstream factors that kind of impact disease formation and disease conditions. So the disease is already kind of forming and developing before you get to the final outcome, disease outcome. So let's target those and address those on a geospatial level. And of course, the demonstration is about that. And so, again, obesity, poverty, all of these things. Even something like air pollution. I mean, who would ever think that air pollution can cause disease formation? I mean, you can have asthma, lung conditions, but this goes way beyond that. Disease conditions, chronic disease conditions. And so you see gaps in management of diabetes. I mean, of course, insulin costs were sky high, and some of the administration actually addressed that issue. So there were multiple places that was kind of important to take a look in terms of social determinants of health, but by location. Let me rewind back and kind of revisit some of the ideas of geospatial analysis. I know there was only a handful of you. So the idea behind geospatial analysis is that, all right, so let's say the whole population within the United States has about 10% incidence or a 10% rate of diabetes. But the question is, does this diabetes actually impact all areas of the United States equally? And the answer is no, because you have certain cities that are more likely to have diabetes. And more importantly, there are certain cities where there are stronger connections between social determinants of health and some of the disease conditions. So you're about to see those maps. So there's a lot of contextual areas, and then of course geospatial analysis is not only spatial but also temporal. So throughout time, is there any changes going on, or are there does the condition stay the same in the geospatial region? So that was kind of the premise behind what we were looking at collectively. Food insecurity, I've done a lot of work in food insecurity, and this was interesting in that context as well. So methods and materials, what we use. How many of you are familiar with county health rankings? All right, so less people familiar with county health rankings than geospatial. So let me go over that. So county health rankings is a treasure trove of data at the county level. So you can get everything from firearm violence to disease conditions, everything on a geospatial level from county health rankings. So this is actually a combination of Medicare, Medicaid data set. And this is a huge consortium and coalition of people that are kind of, and groups, stakeholders that are bringing all of this together. So what I'll be going over first, and this was actually run on SPSS, is multiple linear regression. Because you can actually take a model, right, and look at the relationships on the global level. So you have multiple independent variables, multiple independent variables, one dependent variable, and you're not necessarily looking at the geospatial local level. So you have the global model, and then you have the local models. And I'm going to show you in a moment how those are different. Geospatial analysis via ArcGIS Online. I don't know if you've heard of ArcGIS Online. You can make, once you learn, you can make maps in 10 minutes. You don't have to buy a thing. All you do is sign up for the account and start making maps. So I've actually written books. I have over 1,000 videos on YouTube. So look me up. All right. So GWR, geographically weighted regression, and then multiscale geographically weighted regression. So I'm going to kind of go over that. And could you help me out with time? No, with the time? How? With the time? Yeah. Usually the moderator does that, but you can be my moderator. So this was something that was developed by Arizona State University, and I've actually talked with the originator. You can actually use this same technique in R, and so you can actually, they have now Poisson regression that is multiscale geographically weighted. So check that out, and then now we're getting to the kind of the meat and potatoes of the analysis. So again, this is looking at the global model. There has not been any adjustments made at the local model, at the geospatial model. A lot of geospatial analysis is visual. I mean, you kind of look for the relationships on a visual level, and then on a geospatial level, you're trying to kind of make sense of that. The reason you can run a global multiple regression is because you have over 3,000 counties. So we're looking at granularity level, right? So you can, from what I was explaining at the beginning, you can have the granularity level of the United States, right? If you are looking at multiple countries and comparison of multiple countries, you can actually have a country level. And then you can go into the state level, conduct an analysis on the state level, and be able to look at the distribution. And of course, CDC, you see these maps of comparison of, say, Minnesota to Maryland to Georgia, all of these states. You can kind of take a look and do a comparison. But that doesn't give you information. I mean, look at Minnesota. huge, rural areas. So how can you make the assumption that what is going on within the city is what is reflected in the rural areas and some of the different areas that are available? So how do you make that extrapolation? That is kind of difficult to determine. So then you have to go into the county level. That's more granularity. And at the county level, you're kind of taking a look at what is going on the geospatial level. And then you go down into the zip code level, census tract level, and then point level data. So there's some ethical considerations and concerns when we're thinking about point level data, because point level data is not always easily accessible. You can easily identify somebody's that lives in a zip code that not many people are living in. Then you can just pinpoint and say, oh, yeah, this is this person. If they're your neighbor, and oh, they're talking about the person next door. And so that's not very personally identifiable information is easily sought when you do that. So that's a controversy for point level data. So I'm kind of going on a tangent, but this kind of is important. So this is the global model, and basically what we're seeing is that at the global model, there's some explanation. The indicators can explain the dependent variable at the R-square value of this. The reason I'm actually showing you the R-squared for the global model is because we're soon going to be comparing this to the local model, and then from the local model, you can kind of take a look at it. And I'm going to give you the theoretical framework of the idea to do local and then geospatial, multiscale, geographically weighted regression. Now notice one thing I wanted to bring to your attention is that the dependent variable, the outcome variable, is actually type 2 diabetes. So this is not the incidence of type 2 diabetes. So we're not looking at diabetes on a personal level. We're looking at diabetes on kind of a regional level, right? So you kind of understand that. So these are all the variables that we were looking at. Food environment index, Hispanic, female graduation rate. All of these were fitted into one model, and that's the that's what that one model was. Now I want to go over in terms of geographically weighted regression and then multiscale geographically weighted regression, right? So if you look at the adjusted R squared, slightly better, the multiscale geographically weighted regression than the geographically weighted regression. So what is the difference, right? What is the difference between the global model, where we're looking at the whole United States as a chunk, and then when you kind of break that down, so what these are doing is you're looking at, of course, OLS is the global model, and then geographically weighted regression, your bandwidth, so the area that you're looking at is kind of like surrounding the point level data, surrounding kind of the local. If this is county level, then surrounding that area. But you're not changing the bandwidth at all, according to the location. So that's kind of a weighting, but the same sort of weighting throughout. But when you're looking at multi-scale geographically weighted regression, what is happening is that you're actually altering what is surrounding the area. If it's county, then surrounding that county, you're actually looking at that whole area. So that's that. And again, the idea is we're trying to create a model where you're able to relate social determinants of health with the disease condition that is available. And so that's kind of the premise behind this whole analysis, geospatial analysis. Now to the maps. You were probably waiting for these maps. I mean, this is a geospatial talk, so you got to have maps. Prevalence, this is the 2018 type 2 diabetes prevalence hotspot analysis. So looking at this, I don't know if there's pointers, but are we able to? Oh yeah, all right, great. So looking at these hotspots, right? So Red means there is an increased incidence of diabetes over here in the South. And obviously, any public health practitioner knows that in the South, there's a lot more disease, a lot more poverty. And so that's kind of known as initially the stroke belt. But if you look at chronic conditions, there's a lot of them, and that's connected to poverty. And so this is the hotspot analysis. You can kind of also see the Appalachia region. This is kind of into the mountains, and a lot of industry are no longer present in these areas. They kind of have gone overseas, some of them. And so you see a higher preponderance. So when I first started this talk, I'm like, I said that a lot of the geospatial considerations are actually visual. They're not looking at necessarily statistically sound. I mean, this is statistically sound, but you have to look at the patterns. So you're now looking at kind of controlling for some of these conditions. So these areas kind of are highlighted. And then so this is looking at type 2 diabetes and then food insecurity. So what are the areas? Now we're looking at what are the areas that there's a connection between food insecurity and type 2 diabetes. And so these are the areas kind of, you actually go down into Florida, but if you compare that to the left, a lot of these areas are not necessarily there, but they're still around Texas, Mississippi, Alabama. There's points that you kind of see that going on. All right, so going down now, looking at food insecurity and diabetes. So the dark levels, the black levels, are the areas that you have high preponderance of disease and high preponderance of food insecurity. And again, the South lights up. Surprisingly, though, Maine kind of lights up there as well. So again, that's something visually that is important to note, is because why are there patterns in certain parts of the United States? What is going on in those places? And you can kind of conduct an analysis in those areas, maybe local level analysis, or go to the state level. I'm going to show you in the next map how to do that. All right, so summary of results. We're looking at Texas and Georgia. We're like, let's hone in and take a look at the state level. I mean, you have all of these patterns on the national level, but what is going on the state level? In terms of the state level, if you look at Texas, you have kind of a, again, we're still looking at type 2 diabetes and food insecurity. You look at the eastern portion of Texas, right? And you have all these areas. I mean, this is all of Texas. We're seeing patterns within one state. So you have to go into the county level. You have to go into the zip code level to make sense of anything that's on this map. So what is going on Eastern Texas? I know there are some shootings that took place in Uvalde, and so there's incidences that take place, and so that actually necessitates the illustration of a lot of these maps that are taking place. So that's that. There was some exclusion criteria. The income, these are the low income levels. So basically the top map is there, and then this kind of highlights the areas that have both food insecurity and type 2 diabetes. Again, in Georgia, I don't know, I'm from Atlanta, so I know a lot about Georgia. There's a lot of areas, there was a lot of areas in the South that had higher preponderance of food insecurity along with type 2 diabetes. So visually, you can see the connections being made, and then how are we doing? Huh? Good. All right. So you have these again these pockets. We already went over that of diabetes, and then going into food environment index and food insecurity, and then kind of showing the relationship. Oh, I'm going. All right, so that's why it didn't make sense. We already went over that. It's going now. I'm going backwards. All right. All right. So conclusion and discussion. Let's wrap this up here. I've talked plenty. There's actually type 2 diabetes, obviously on a medical perspective, and that's the MD talking in me. You have physical conditions, right? You have Alzheimer's disease, you have chronic kidney disease, cardiovascular disease. Some of these are affecting women and vulnerable populations. So how do we address that? And that's where we actually, one of these is my student's dissertation. We talked about this and we're able to create an analysis. So there's physical conditions. Obviously, there's genetic conditions, but there's geospatial conditions. So you have location is an important concept. I mean, in Washington, D.C., you can go like 3 miles from where you're located, and you'll see the life expectancy go down as you're going from one location to the other. So location is really important to be able to understand all of the whole gambit of areas that are there. Community-based participatory research, that's an important concept because you have to kind of like how she ended, because you have to involve the stakeholders that are there in order to impact any sort of change or implement any sort of change. So there has to be strategies for human development and economic growth. Again, addressing the upstream factors, of course, that's important. And then GWR and MGWR, more to come on that because there's actually more techniques that are being developed. You can purchase the book on Sachdeva and Fotheringham if you're familiar with either one of them from Arizona State University. So that basically concludes my presentation. Thank you for listening, being an attentive audience. And here's my email, phone number, and contact information. So, all right.